That was Lauren, and that is what end-stage liver disease looks like. Lauren was on the brink of dying after having literally nearly drank herself to death. I've cared for many patients who looked just like Lauren. Now here she is again after a liver transplant.
In discussions of alcoholic liver transplantation, it is often argued that a 6-month period of sobriety should be required.
Okay, so she was able to get a liver transplant despite having essentially destroyed her own liver through alcoholism. No judgment. I'm a recovering alcoholic myself. There, but for the grace of God, go I. But she happened to be in a hospital that was doing a new program where they're evaluating patients with alcoholics cirrhosis of the liver to determine if they feel like they should qualify for a transplant. As Lauren said, many transplant programs, most actually, require a 6-month waiting period during which the person has to be sober before they will give them a new liver. Many people don't live that long, even if they are able to quit drinking alcohol. Back in 1994 and 1995, David Crosby and Larry Hagman, respectively, were liver transplant recipients. It was very controversial because they were known alcoholics. People thought it was unfair they should get a liver when they had destroyed their own. Clearly, it was all about their status and their wealth. To be honest, at that time, I agreed that they should not be able to get new livers. Why them and not other people? And especially when they did it to themselves. I was a few years into my own first round of sobriety, long story there, and probably feeling a little judgmental. But just about a decade later, I had an experience that gave me a change of heart. James was a hospice patient who was 52 years young. He was an alcoholic with cirrhosis of the liver, and he came to our care center to die. Although that is not what he thought. He was trying to get on the liver transplant list, and he needed to be sober for 6 months. So it was his hope that by being at the care center, he would not be able to drink and he could meet that sobriety requirement. James was with us for several months. He would do very poorly and then he would improve somewhat. And that is the nature of liver disease. The liver does have the ability to regenerate itself to a certain degree, so it can be a very roller coastery type of process. During the times when he was alert and awake and not confused, James was a wonderful human being. He was funny and smart, and he was very, very, very much loved by his 5 sisters. He was their only brother, and they adored him. Unfortunately, James didn't live the 6 months that he needed to be able to get a new liver. By the time he died, he looked just like Lauren did. Alcoholism is a disease, and just like with any other disease, people shouldn't be denied a chance for survival if there is a treatment available, or in this case, a liver.